Well, we have a really exciting conversation now with Conor French. It's a fireside chat without the fire with Zipline. And as you all know, and I'm sure have heard through the industry and seen in the news, Zipline is up to so many exciting things lately around the world. So Conor, just to start, tell us about Zipline's operations and about your growth around the world. What are you all up to these days? Because you seem to be everywhere.
Yeah, well, can folks hear me okay?
Yeah.
Great. I want to start by thanking the Commercial UAV Expo and the Mirage staff for having us. Zipline operates the world's largest automated on-demand delivery service. Our purpose is to transform health systems and to serve all humans equally. Our instant logistics service includes an autonomous aircraft fleet, as well as autonomy software that are designed and built to flexibly integrate with the existing logistics systems of our customers, such as governments and health systems. There are many communities, particularly rural and remote and in tribal areas, that lack sufficient access to blood, vaccines, and other vital medicines that may be taken for granted by those of us who live in cities and suburbs. This lack of access can take place for a variety of reasons: distance and geographic constraints, limited supply or perishability, high prices, difficult handling requirements, and many more. But these disparities have very real health and societal costs, and we created Zipline to solve this problem. I'm going to quickly show a video that gives a sense of what this looks like in the real world.
Great.
It's cooperating so far. Uh-oh. Let's try one more time. So this is actually Vobzi in Ghana. This is an actual distribution center taken during a day where we're launching and recovering zips and sending medicine out to hospitals and rural environments there. What you'll see here, each triangle there represents an aircraft that is out delivering to the dots that you'll see, which are health facilities throughout the country. You can see sort of through our interface that we've built in-house the count of the number of aircraft that are in the air simultaneously, the number of products that have been delivered, the number of packages that we've completed delivery. And I think this is important because, as was said in the last panel, this is well beyond the pilot stage. Our capabilities have very often outpaced the freedom to operate, and there's very real impact that can be had by seeing these operations in action. Our footprint right now is primarily at 6 distribution centers in Ghana and in Rwanda. So we're doing this at national scale. Each of those distribution centers can cover about a 50-mile radius, so about the size of Connecticut in terms of creating deliveries. And using this system, we've been able to make over 800 deliveries in a single day. We've done over 180,000 commercial deliveries since inception, and we've delivered over 2 million units of medicine. So it's really exciting to see what is happening out there in the real world. And I'm going to, as much as I love the video, just press on to sort of a little bit of an image of what this looks like, with each, again, distribution center as the center of a circle, and the dots as all of these 2,500 right now health facilities that we're able to serve from the 6 distribution centers. And that covers roughly 25 million people. So again, there are billions worldwide, and our mission is to provide health access to all humans on the planet, but we're starting to get there in a very real way. It's important to also note that this isn't just going on in Africa. We are excited to launch soon in the US to begin serving hospital systems. This is an image of one of our first 2 distribution centers here in Pea Ridge, Arkansas, adjacent to a Walmart, where we'll be delivering health and wellness products. And we'll also be serving the Charlotte metro area from Kannapolis, working with several hospital systems there.
So amazing, Connor. And what really strikes me in watching the videos, is that your technology is ready and you're already operating at scale. So this isn't when we talk about the potential benefits of drone use, this isn't some potential, it's really there are clear benefits today.
Yeah, absolutely. I mean, there are so many positive benefits that UAS can bring to our communities. I want to quickly highlight 3 of the most impactful. First, UAS can bring life-saving medical treatment out of hospitals and into community-based care. In Rwanda, when we began, the Ministry of Health trained doctors and nurses to give blood transfusions. Today, a patient in a rural clinic would have access to both the blood they need as well as a trained doctor or nurse to administer it. Second, UAS infrastructure can make healthcare supply chains more resilient. At the beginning of the pandemic, we began delivering chemotherapy drugs to local clinics in Rwanda. Previously, only one hospital was able to do that. And so by bringing the patient care closer to the patient, we were able to cut down the travel time from 8 hours to only 1 hour. Third, UAS infrastructure can make transportation systems much more sustainable. We can bring deliveries off of the ground and out of gas-powered vehicles and into small, lightweight electric aircraft. This means that communities can safely receive instant deliveries without additional noise, pollution, traffic, or collisions.
Absolutely. So, given all of these many benefits, of course, as Administrator Dixon discussed with all of us this morning, safety is paramount as well. And I know that Zipline absolutely prioritizes safety. So can you talk to us a little bit about that?
Yeah, absolutely. I mean, the bottom line is Administrator Dixon is right. Safety is top priority, full stop. Zipline has safely integrated national scale UAS into the airspace of 2 countries. We're in the process of doing that in 3 additional ones: Nigeria, Japan, and the United States. Based on our learnings, we would challenge the US to learn from some of what these other nations are doing in our approach to assessing and achieving target levels of safety. To assess safety, America needs to look at the whole picture of whether a given UAS operation makes a community safer or not. This determination is really the only way we can know if it's in the public interest. As we think about sort of getting towards the target levels of safety of an industry, I also want to make sure that we are thinking about that we can't wait to sort of start flying sooner, and that we need to put aircraft in the air to conduct meaningful operations now so that we can provide industry and FAA with real opportunities to learn to inform the standards of future rulemaking. Solving real problems for real Americans is going to give us the real feedback that we need to truly integrate UAS into our communities.
No, absolutely. And obviously, as you mentioned, and you guys operate in the US, but also around the world and really at scale in other countries. So what are some big differences that you see in terms of how other countries are approaching some of these issues?
Yeah, there's some pretty big differences. There's, on the competitiveness side, it does feel like today China is leading in the UAS market. One Chinese manufacturer accounts for 70% of the global, commercial UAS market. By contrast, American manufacturers combined market share is about 7%. I think that reflects, the possibility of both safe integration as a regulatory goal, but also global UAS leadership. And so I think we're seeing many other countries that are making quick steps to, and using sort of practical problem solving in order to safely integrate UAS on clear timelines to benefit their citizenry. In the United States, by contrast, we're applying a regulatory framework that was designed for commercial passenger jets, 200-ton aircraft flown by multiple pilots, carrying hundreds of human lives. And so, as a result, as an American company, it is harder for Zipline to serve communities here than it is to serve communities abroad.
So how optimistic are you about the future of UAS here in the United States, and how can the US maintain our aviation leadership and innovation?
Yeah, let me start by saying I'm very optimistic. I'm very optimistic about the benefits and the positive impact that UAS can have on communities in the US, particularly our most vulnerable ones, to boost healthcare equity and access and consumer convenience. I'm also really optimistic about what this means for the health and safety of these communities to transition away from fossil fuel consuming ground transportation and into lightweight, safer, electrified air transport. I'm not as optimistic about the pace at which we're realizing these benefits for American communities now. Historically, America has been at the forefront of aviation innovation. 60 years ago, President Kennedy told Congress we would go to the moon. Less than 9 years after that, Neil Armstrong took that first giant leap for mankind. In 2012, Congress instructed the FAA to integrate UAS into the national airspace by 2015. Yet 9 years later, we're sitting here that not one UAS type has received standard airworthiness certification. There's no commercially scalable beyond visual line of sight approval. And there's no clear path towards implementation of critical things like detect and avoid and UTM. And so I think we want to see what we can do to work to restore that America can take back that step of being in the forefront of aviation. And I think that's rethinking the way we're looking at safety, to do it more holistically, to compare the benefits and the risks of UAS against the benefits and risks of the status quo of doing nothing or using existing transportation solutions and sort of things like that.
I think that's a really important point. We often talk about the benefits of this industry moving forward, but we don't think about the opportunity cost of not moving forward at the right pace. What we're missing out on in the meantime.
Yeah, I think it's important for people to realize that it's not just me or Zipline that's requesting change here. It's U.S. health systems, it's pharmacies, it's distributors and retailers that are actively seeking UAS delivery in order to expand health access, to improve the supply chain resilience, and to reduce carbon emissions. These are our customers, and they tell us that every day. We need to really rethink and craft a new approach for how we're going to regulate UAS. As I mentioned, I think we need to stop using a regulatory framework that was designed for 747s and applying it to a 40-pound styrofoam aircraft with a 5-pound payload that's flying predetermined routes. These aircraft have fundamentally different risk profiles and operations. In creating the new approach, we're excited to see things like the Beyond Visual Line of Sight ARC. I think that's a critically important step to a more sensible and proportionate regulatory framework for the types of operations and the aircraft we're dealing with. A member of the Zipline team was one of the industry leads alongside yourself, Lisa.
Yeah.
But I really want to emphasize in the short term that we can't really afford to wait years for new rules to take effect. The technology is there. And similar to our own operations, our overall future safety is improved by us getting flying sooner so that we can learn and inform rules and standards based on actual operational experience. I also think it's important that we have Part 135 and Section 44807 that provide the necessary authority for us to get medical drone delivery in the air, saving real American lives today. And it just takes a commitment for us to demand bolder results. I really think that American aviation has made great leaps for mankind before, and that our communities are counting on us, particularly our most vulnerable ones, to do it again here.
Absolutely. Well, thank you so much. With that, I think we're about out of time. Conor, we're very inspired by everything Zipline is doing. Thank you for all your hard work, to your colleagues as well, and keep up the amazing work around the world, and hopefully more in the United States soon.
Thank you all for having me.
Great. Appreciate it.